The research is something that we've done together as a team at the Leverhulme Centre for Demographic Science, and it's a lot of evidence-based, empirical, data-driven policy making. And the main topics that we looked at were during COVID. We've done it in a feedback loop where we got questions from policymakers and we had an exchange with them and looked at different aspects. And those were things early on, such as looking at the population composition, the ethnicity, the age structure, and how that would influence hospitalizations or deaths. We also looked at learning loss, so children in school. Was there a socioeconomic disadvantage for certain groups? We looked at social bubbles and social networks and how interaction with each other influenced the pandemic and in numbers of infections. But we also looked at a lot of social behavioral interventions, things such as face coverings, vaccine hesitancy and deployment, COVID certification and vaccine passports. So we looked across a wide array of issues.
We have people trained in demography, economics, data science. I have a background in infectious disease, so that really did help us have the entire toolkit that we needed.
And we divided up our tasks because we had to react very quickly. And then we came together and we started to produce this incredible research.
Our work tried to address some of the problems that policymakers faced in terms of the lack of structured data sources. We undertook lots of simulation work, we built lots of data visualizations in the form of dashboards and tried to provide as much information in terms of systematic reviews to policymakers as possible.
We were in the middle of the pandemic and there were some major issues, which was the reason that the British Academy and the Royal Society collaborated on a series of reports, and Melinda Mills was a leading researcher on two of these.
It's been impressive how Melinda is able to access large amounts of data and to statistically analyse those data to extract information that perhaps isn't obvious at the more granular level.
So we stood back and looked at all of the evidence and we assessed it, we analyzed it, we synthesized it, and we brought it together and we presented that. And I think that was unique, that we could do that in a very rapid way, working together as a team. You know, a big challenge that we had was trying to communicate that you really need a multidisciplinary approach that looks at the pandemic from multiple sides, and that's what we could bring in.
Our research, which Melinda Mills led on, indicated that actually the evidence suggested it was valuable to wear a face mask. It was noteworthy that it was very soon after that research was published that the government policy changed in that area.
Within the last year, in countries such as the UK that were not used to wearing face coverings, there's been a radical transformation in how we see them.
Once this was proven and well accepted within society, there was obviously another set of policy challenges relating to vaccine hesitancy, for example. And so at each stage throughout the pandemic, there's been a new set of policies to construct and address.
It's hugely important that we collaborate with others. I absolutely could not have done anything that I did during the pandemic by myself.
The way that the team, especially in the early days, kind of pulled together and rallied around and made all of our kind of interactions on an almost second-by-second basis was absolutely fruitful and one of the most productive environments possible.
We were able to show government, policymakers, and policymakers not only in the UK and around the world that demography matters, that rigorous scientific evidence matters, that an interdisciplinary approach matters to solving problems. So we were actually, with our research, able to change policy in relation to face coverings, in relation to thinking about population composition, about learning and socioeconomic differences.
It was a unique experience for members of the Leverhulme Centre to be able to contribute directly to kind of high-level government meetings with evidence at such a direct level, and this was something that I think was very important for the changing of policy and the impact that the team has generated.
Being able to look at these problems through the lens of social science has been a powerful tool in addressing the challenges that we face.